Welcome. My name is Laura Canali, and I'm part of the global GBVIMS technical team. This resource is available both as podcast and video short. This episode on prerequisites to shift service delivery into remote case management is part of a series on GBV case management in the context of COVID-19. For the full episode, check out our website, www.gbvims.com. During this episode, we will discuss when to consider remote GBV case management, what you need to do to shift to remote GBV case management, and who should provide it. This episode is therefore speaking to GBV managers, caseworker supervisors, and also caseworkers. Please note that if your organization already shifted to remote case management, this guidance can be used to identify steps that might have been missed in the process, but can still be done to better support your intervention and your case managers. Let's start from the when. When to consider remote case management over the phone? There are two scenarios when remote case management over the phone might be needed. One, when there are no dedicated and confidential places where to meet with the survivor. During COVID-19 response, in many countries, gathering of people is prohibited. Therefore, many group activities at the women and girls safe spaces or in other places might be suspended. However, women and girls safe spaces could still be used for individual support to survivors. With the needed infection prevention and control measures in place, which include masks, sanitizer, gloves, social distancing, the caseworker might still be able to go to the women and girls safe spaces and meet the survivor. This is, of course, dependent on the government restrictions to contain the spread of the virus. When this space or any other confidential space is not available, for example, because movements are restricted and people, including the caseworkers, must stay home, then we might need to shift to remote case management, meaning case management by phone. The second scenario is when there is the space available, but the survivor is not able to physically come to meet the caseworker. For example, the women and girls safe spaces or other spaces where case management services are offered might offer the space, even if close to group activities. And the case manager might be able to go to the women and girls safe space, but the survivor cannot come due to restriction of movements imposed to the population or due to other reasons. Let's remember that while during the regular programs of the women and girls safe spaces, survivor can more easily access case management through the participation on one of the many activities organized, in this period, group activities might be suspended and therefore might be more difficult for the survivor to come to the women and girls safe spaces. If we are in one of these two situations, we can consider shifting to remote case management over the phone. Please keep in mind that remote case management should be provided only if we can guarantee safety and confidentiality of caseworkers and survivors. A service that cannot guarantee safety and confidentiality or put survivors or the caseworker at further risks will do harm and therefore should not be implemented. Once you confirm that remote case management over the phone is needed, what do you need to do to be able to do the shifts? Number one, consult with your caseworkers to discuss the possible modalities of service. Because caseworkers are those providing the service, it is important to discuss with them this option and the way of doing it, including any question or concern they might have. While discussing these modalities, always ensure that safety and confidentiality of survivors are guaranteed. Remember, no safety or no confidentiality means no remote case management. Number two, decide how to manage current open cases, considering the amount of open cases, the number of caseworkers able to provide remote case management, the capacity of the caseworkers, the time they do have to provide case management, the shifts of the caseworkers, and their locations. For example, if there are many open cases, consider closing those that are almost closed already, and prioritizing those at higher risks. Do you need to reallocate some open cases to other caseworkers? This will imply discussing and explaining this option with the survivors and seeking her consent before reallocating the case to another case manager. Number 3, decide if your organization is able to take on new cases. Do you have the needed capacity and resources? How you will do that? With a hotline? Please note that on hotlines, there is an IRC remote and mobile service delivering guidance not to be consulted. Number 4, create an SOP to guide the caseworkers on how to provide the service. These might include the details such as from where to provide the service, which days and time the service is available, shifts of caseworkers on call. On this topic, keep in mind that if they are working from home, they might also need to take care of kids or be busy with personal tasks. So they might not be available the same amount of hours they were available when working from office or from the Women and Girls Safe Space. What to focus on during the phone calls with the survivors. How to do safety planning for survivors at risk of IPV while confined at home. How to document cases. Modalities of remote supervision that must be provided to caseworkers. Procedures to close the cases and dealing with the life-threatening situation. Please note that on most of the above mentioned points, you can find dedicated episodes in this COVID-19 series. Number 5, ensure the needed supervision and staff care for the caseworkers working from home. Even on this, listen to the dedicated episodes. Number 6, provide caseworkers with a proper orientation on how to provide remote case management. Giving the caseworkers the written SOP is definitely helpful, but not sufficient. Provide them with a session to discuss the modalities of the remote case management and how this differs from the in-person case management, and allow them to ask questions or discuss concerns. Number 7, make sure to procure mobile phones for the caseworkers, or at least a dedicated SIM card, and the needed credit to call the survivors, other service providers, the supervisor, or other colleagues as needed. Caseworkers should not be using their personal phone number to provide case management. Number 8, update referral pathway. During periods of social distance or movement restrictions, many service providers might have changed their modalities for service provision, reduced staff, or even closed. It is therefore good to review the referral pathway. Even on this, listen to the dedicated podcast and video. Finally, once you know GBV case management is needed and you know what to do to prepare the intervention, you will need to define who of your caseworkers are able to provide remote GBV case management. If you are in a situation where it's needed to shift remote case management over the phone, try to understand if your caseworkers, or some of them, are able to provide remote case management. In fact, not all caseworkers might be in a position to provide safe and confidential remote case management. Let's see what you should look at for each caseworker. 1, has the caseworker solid experience in GBV case management? Remote GBV case management can be difficult. Therefore, a caseworker that has no experience in GBV case management might not be the best fit. 2, is the caseworker willing and feel comfortable in providing GBV case management? 3, can the organization provide a phone or a SIM card and the needed credit for that caseworker? 4, is the caseworker living or working from a place where there is a phone signal? 5, is the caseworker able to ensure confidentiality when providing remote case management? If the caseworker is working from home, does she live with other family members? Does she have a room or a space in her home or nearby where she can be alone and talk with the survivor and guarantee confidentiality? Does she live in a tent? Remember, without confidentiality, case management cannot be provided. Thank you for listening to us today. Find out more about the series on GBV case management in the context of COVID-19, and for the full episodes, check out our website. And as always, be responsible with your data and learn more at gbvims.com.